Things you can do to reduce the adverse effects of mobile radiation. Children should use cell phones next to their heads for emergency only. While talking on your cell phone, try to keep the cell phone away from your body as much as possible. Avoid using your cell phone when the signal is weak. Avoid carrying your cell phone on your body at all times. If you must carry your cell phone on you, make sure that the keypad is positioned toward your body. Only use your cell phone to establish contact or for conversations lasting a few minutes. Switch sides regularly. Communicate via text messaging rather than making a call. Avoid using your cell phone in places like bus etc. Choose a device with the lowest specific absorption rate possible. The summary of the recommendation made by the Interministerial Committee on Mobile Radiation Hazard to the Government of India. Mobile handsets. Adoption of specific absorption rate level for mobile handsets limited to 1.6 watt/kg, averaged over a 6 minutes period and taken over a volume containing a mass of 1 gram of human tissue as per the Federal Communication Commission norms of United States. Specific absorption rate value information is to be embossed and displayed in the handset. Information on specific absorption rate values for mobile handsets should be readily available to the consumer at the point of sale, so that one can make sure of the specific absorption rate value of the handset while buying a cell phone. Government may consider amendments in the Indian Telegraph Act 1885 and rules notified thereunder and necessary legislations if any, so that only mobile handsets satisfying radiation standards should be permitted for import, manufacture or sold in the country. Mobile handset manufactured and sold in India or imported from other countries should be checked for compliance of specific absorption rate limit, and no handsets of specific absorption rate value above the prescribed standard adopted in India should be manufactured or sold in the country. Specific absorption rate data information of the mobile handsets should be available on the manufacturer's website and in the handset's manual. To bring awareness, the manufacturer's mobile handset booklet should contain the following for safe use. Use a wireless hands-free system, headphone, headset, with a low-power Bluetooth emitter to reduce radiation to the head. When buying a cell phone, make sure it has a low specific absorption rate. Either keep calls short or send a text message, short messaging service, instead. This advice applies especially to children, adolescents and pregnant women. Whenever possible, use cell phone when the signal quality is good. People having active medical implants should keep their cell phone at least 30 centimeters away from the implant. The information is made available on government website with list of specific absorption rate values of different mobile phones. The RF exposure limits in India may be lowered to 1/10 of the existing level, keeping in view the data submitted by the Cellular Operators Association of India and Association of Unified Telecom Service Providers of India, during presentation made to the committee and trend adopted by other developed countries. To provide static continuous testing and measuring centers for online monitoring of radiation level at prominent places in metros and cities, and the data to be sent to the central server for information. Apart from self-certification for compliance of radiation norms on EMF exposure as is presently being done, the mobile service providers should also measure the radiation level of certain prominent places and display it for information of the general public. They should also have mobile units, for its measurement wherever necessary. Department of Telecommunication should create a national database with the information of all the base station, their emission levels and display on public domain for public information. Impose restrictions on installation of mobile towers near high-density residential areas, schools, playgrounds and hospitals. For the future expansion of telecom network in the country, use low-power microcell transmitters within building solutions, in place of the present trend of using high-power transmission over mobile towers and on high-rise buildings. To conduct the long-term scientific research related to health aspect of EMF radiation exposure and associated technologies in India in the following areas. Health effect of RF exposure in children. Health effect of RF exposure in fetus, mothers and elderly persons. Combined electromagnetic field radiation effect exposure from multiple antennas over shared infrastructure sites. It is recommended for use of hands-free and earphone technologies such as Bluetooth handsets and earphones so as to minimize the contact of head with cell phone. Department of Telecom may create a document radio waves and safety in our daily life indicating various do's and don'ts related to mobile users, clarifying various myths regarding deployment and use of radio waves, and mandate each operator to print and issue the same to their customer at the point of sale for enhanced customer awareness. This will help in facilitating the right inputs and creating an environment where everyone can use the radio waves safely. Conclusion. If an action or policy has a potential risk of causing harm to the public or to the environment, in the absence of scientific consensus, and that the action or policy is harmful, then the burden of proof that it is not harmful falls on those taking an action and not on the victims of such action. There is urgent need to develop health-based precautionary guidelines in India.